Hello everybody, I'm Richard Gon of Active podcast version. I'm sorry, I couldn't speak English well. I couldn't, so what I was trying to say this time is that, so hello everybody, I'm Richard Gon of Active podcast version, so I'm not even good at speaking my own name. Anyway, so I couldn't pronounce well. I have stumbled when I'm greeting or when I'm introducing myself to you. Anyway, so that is because I'm a non-native speaker. One of the reasons is that I'm a non-native speaker of English language, and another reason must be that I'm a little bit tired because recently my works were a little bit busy, so my works were busy a little, so which is why, so I'm tired a little, so which I think is one of the reasons why I have stumbled in the beginning of this episode. Anyway, so this time the title or the track of this episode is related to COVID-19 or the pandemic of coronavirus. Anyway, so I frequently digress in, and I have digressed in every episode in the past. So I mean in every episode in the past of my well, every episode of my podcast, which is what I was trying to say this time. Anyway, so but actually, so which is why thinking about such digressions. So I'm going to tell you the title and the not topic. I'm going to tell you what I'm going to tell you is the title and the conclusion of this episode. And anyway, the title is "The Seventh Crest of Coronavirus has arrived." And the conclusion is some of the news in my country says that the seventh wave or crest has come and people should be careful. But only thing people need to do is just to say, so what? COVID-19 is over. I'm sorry, this time the conclusion is really long. So to start with, so you may not think that is a conclusion. You may not think like, so that is not a conclusion. The conclusion is too long, and so to start with, it's redundant. So which is why it's possible to omit or prune some sentences or some words, like and so that Richard Gong may be able to create a shorter conclusion, I may be able to create short, or I may be able to not oppress, or so shorten. I may be able to shorten the composition I have just spoken out. Anyway, which might be your idea. Anyway, so I'm going to speak out. What I'm going to speak out is that, so to start with, this is my idea, but actually, so maybe not maybe the pandemic of coronavirus has been still prolonged in maybe in every country, I think. So maybe each developed country and each developing country has their own situation about the pandemic of coronavirus. But actually, so generally speaking, the pandemic of coronavirus, or that pandemic of COVID-19 has already been over. I mean, so it's thinking about the entire pandemic of all over the world, which is what I'm saying. So so to, the fact or the truth is that, or in fact, anyway, so the pandemic of coronavirus has still existed, or has been still alive in my country. The pandemic is still alive in my country, but actually, so, and as I have just told you, the seventh crest or the seventh wave has come to my country, which is the news of my country say, or have said. Anyway, so so there are many news broadcasting that, so that the seventh wave has come. Anyway, so in my mother tongue, the Chinese character meaning wave it's used for calculating or for counting the number of the crests of the pandemic of coronavirus anyway. But actually, so I think this is my idea. But actually, so so peaks or crests are suitable words for for using the calculations because so, of course there are many waves actually. So it is why but waves have crests and troughs, which are the factors composing waves, which is how I'm thinking of. I'm thinking of the waves of numbers of the pandemic of coronavirus anyway. So I'm sorry for my complicated explanation, but actually, so in this pandemic or I think in every pandemic or of the diseases, one of the important things is that so this is I think this is an achievement of human beings, but actually so so specific to this pandemic of COVID-19. So human beings have created a cycle of vaccination. So which means with which what by using those words, what I'd like to tell you is that so so what is important is that human beings or we have created a cycle of vaccinations in which so people are vaccinated once an interval or every interval people have taken vaccinations. So for example so in the case of my country, so every 5 months or every 6 months or every half a year people take vaccines, or people are infused with vaccines or vaccines against coronavirus, which is the situation of my country. And so how to do is that people are infused with a syringe of vaccine, or some kind of maybe that syringe has some kind of liquid containing some maybe that is a copy of messenger RNA of COVID-19. Maybe so, not every time the new strains of coronavirus are produced. Not just stuff like that, but actually, so if they are newly created strains of coronavirus, it's fine to create vaccines against those newly created or newly born strains of coronavirus. It's fine to create such vaccines against those new strains, which is how people can protect themselves against the pandemic or against the infection of COVID-19. Anyways, so what is important is not only that you have been vaccinated, but also human beings have created such cycles of vaccinations. Maybe of course each country may have different patterns or different cycles of vaccinations, but actually what matters is that human beings have successfully created cycles or patterns for vaccinations, which is a remarkable achievement of human beings. Which is a remarkable achievement human beings have created against coronavirus. So thinking about which, I don't think the pandemic of coronavirus is important, or so what I'd like you to know is that the pandemic of COVID-19 has already been over, and the pandemic of the was a anyway, also maybe you live in a country in which the pandemic some wave or some crest of the pandemic, or not the pandemic. So you may live in a country in which some new crest of the number of the pandemic of coronavirus has come, but actually, so thinking about the fact that human beings have success, or beings could create such vaccinating cycles, or such vaccinating patterns to protect them, human beings themselves. So we do not have to be worried about the pandemic causes. The further crests of the numbers of the patients of coronavirus. So maybe I have spoken about the crests of the pandemic of coronavirus, but actually, or the number of the pandemics of coronavirus. But actually, so in this episode, what I'd like to tell you is that the waves, or the crests of the numbers of the patients of coronavirus. I'm sorry, so I have repeatedly told you that the waves of the pandemic of coronavirus, or the waves, or the crests of the crests of the pandemic of coronavirus is a kind of a correct word, but actually, is a kind of a correct set of words, but actually, so to imagine the correct graphs, or correct, how should I say, correct, so diagrams, or correct curves of the crests of the pandemic of coronavirus. I recommend that you imagine the crests, or the waves describing the numbers of the patients of coronavirus, which is by imagining the curves of the numbers of the pandemics of, not the numbers of the pandemics, but also the curve, by imagining the numbers of the patients of COVID-19, by imagining which, I think you can understand what I'm talking about. So I'm sorry for my complicated explanation, or really confusing explanation. So, and I have accidentally, or I have mistakenly switched the word pandemic with the word the patient. But actually, so what I'd like you to know this time is that the pandemic, nor the number of the patients of COVID-19, or the number of the patients of coronavirus are no longer important, which is what I'd like you to know this time. So before actually ending this episode, I'm going to tell you the title and the conclusion of this episode. The title is "The Seventh Crest of Coronavirus Has Arrived." And the conclusion is, some of the news in my country says that the seventh wave, or crest, has come, and the people should be careful. But only thing people need to do is just to say, so what, COVID-19 is over. So, although, this time in my country, the seventh wave, or the seventh crest of the number of the patients, of coronavirus, or the number of the seventh wave, or the seventh crest of the number, or depicting, or describing, or indicating the number of the patients of COVID-19 has arrived. But actually, so to start with, the pandemic of COVID-19 has no longer been important for human beings, because human beings could overcome that disease, or the disease named coronavirus, or COVID-19, which is what I'd like you to know this time. So that's it. Thank you very much for your listening. See you. By the way, I forgot to tell you that, not that I don't tell you the date of this recording, but actually, so I'm creating, or I was creating this episode of podcast on July in 2022, but actually, so in the middle of July in 2022, which is not duration, which is the time I was creating this episode of podcast.